Hello, assalamu alaikum, jiayanu, pakhair agale, ni hamachu, neshume, washmale, ohio, gonzaimus, and highs and hellos to all those beautiful, amazing faces who are actually tuned into PT World, watching World this morning alongside Shazad and Maha. Hello, Maha, how are you? A happy Monday.
Happy Monday to you too. How was your weekend?
My weekend was just fine. I was lucky enough that I went on to see my cousins, stayed over there, and then we cooked biryani together.
Okay,
so it was quite a lot of fun, very relaxing.
Good.
But on another note, I so wanted to be back.
My weekend was really good, though.
All right.
Thank you for asking.
Yeah, so how was your weekend?
No, it was fantastic. My dad arrived yesterday, so I'm feeling very relaxed. And I think he's watching today, so I'm a bit like, oh gosh.
Hello, Uncle. Assalamu alaikum. Thank you very much for being on the soil.
Oh, yeah. Okay, so what were you thinking about this weekend?
Okay, with this weekend, the only thing which I was thinking about was that, I'm not going to say that, but, I've got a few family members who are so into getting their jaw extensions and all of this done, but then I am reluctant to go for any of this sort because of the fact that, half of the time what happens is that people say, my mother says that, when you're going to turn 40 or 45, all of these things are just going to drop away and then you look more horrible. Then you need to be sure about it.
So for yourself, you're not such a big fan, but how do you feel when other people are getting plastic surgery? Like, how do you feel when you find out something is not natural?
It's just like Photoshop in real time. All right, so half of the time when we see all of these models and these cover pictures on fashion magazines, they literally do not look the same. So when you see them off the camera or off the cover, you're like, well, is it the same person or the same guy or the same girl? Because half of the time their belly's being extended and then legs being lengthened and all of that stuff. So I'm not a fan of that. But if somebody can actually be satisfied with what he or she wants, I mean, go ahead.
Okay, that's one aspect of plastic surgery and things like that. However, there is another side. Almost 80% of plastic surgery is reconstructive plastic surgery. Now, there's a distinction between the two. One is cosmetic and one is reconstructive, right?
Okay.
Now, with the reconstruction, psychologically, what these surgeons are doing, they're making you be yourself again, something that you identify with. Because, your self-esteem, everything gets destroyed when maybe you have a scar or, you've lost a limb.
Or you're losing hair.
Yeah, exactly. Now, cosmetic surgery is something that you want to be, and psychologically that's not always healthy because we have an idea of beauty and it could be quite warped sometimes. So we're going to talk about that too. So
I can even relate to that because I've always loved horses. So we were standing by the horses, me and my friends.
Okay.
So one of the horses actually bit his ear. So half of his ear was gone. So then we had to go look for other plastic surgeons who were out there. And then that's the time when I actually got to know that, there can be these type of surgeries as well. But then on another note, I still remember 4 years back, I went to UK for my backache pain surgery or, backache surgery or lumbar spine surgery. And the only reason why I didn't get it over here in Pakistan was that there were so many stigmas attached. People said that, if you're going to get a surgery done from here in Pakistan, you might probably not even walk again. So it was like, okay, really? And I was like, yeah. So then we just went abroad.
Okay, so that's another aspect that we're going to talk about. We're going to talk about neurosurgery as well. And what is the situation in Pakistan? What are the resources? And, are the government and the private sector working hand in hand? So for that, we've been joined by some wonderful guests in the studio. And it'd be nice if we could get some air in here because I'm about to melt.
I'm already melting.
Yeah, so besides...
See, the finger's gone smaller.
Okay, besides me, I've been joined by Dr.Rayif Rasheed Kant. He is a neurosurgeon. He's also the assistant professor of neurosurgery at Islamabad Medical and Dental College.
And he's a proud student of Dr. Uzair as well. What a name in the industry as well.
Assalamu alaikum, good morning. Thank you for joining. We're very good. How are you today?
I'm fine.
And you can relax, you don't have to be so serious. Besides Dr. Rayif, we've been joined by Dr. Uzair Ahmed Qazi. He is a plastic and reconstructive surgeon. Assalamu alaikum, good morning. Thank you for joining us.
It's a pleasure.
Thank you for coming over, guys. I mean, it is our pleasure as well to see such learned men over here in Pakistan dressed so smartly. But then at the same time, you want to get started?
I want to get started.
All right, get started.
Okay, so I'm going to start with the plastic surgery aspect of it all. So what is the situation in Pakistan right now?
The situation is coming up now that people are really aware, and we've got social media and all the TV channels and everything. They're covering all aspects of plastic surgery. So yeah, people, as far as the know-how goes, people are getting to know about plastic surgery, and we are getting patients who are actually, they've researched what they want to do and they know more about the specific procedure they want to get done than we do sometimes, and it gets difficult nowadays.
But then how come that, there are only 80 or 90 plastic surgeons to a population of 200 million?
Yes, because I think plastic surgery wasn't really recognized as a necessary field in Pakistan for a long time, and then some of our mentors, the four legends of plastic surgery here in Pakistan, they kind of brought this to the attention of the authorities, and
then the media picked up, and then
yeah,
the
media
girls
always
wanted
has a
get
role to play.
Themselves some that pouty lips and tummy tucks
Yes.
and whatnot.
Yes, because it's always more economical if you get those things done in Pakistan than going
Yeah,
abroad
exactly.
for them.
Okay, so that's the situation of the plastic surgery right now. So what about in neurosurgery? Where are we?
Well, it's almost the same around here as well.
Okay. Oh God, you sound so. That sounded so dark and like, oh my gosh.
No, actually, what
Batman's
the
there.
problem is that people think that neurosurgery is a sort of a field that nobody would be around. Like he said, nobody was able to operate on him in Pakistan, and he had to go all the way to UK. Well, that's not right.
Okay.
We're having endoscopic surgeries in Pakistan as well, in certain centers, even in Islamabad. In Shifa, it's been happening. It's in also one of the best centers is LGH Lahore and Aga Khan Karachi.
Okay.
So it's not like we don't have any neurosurgery. But the thing is, when it comes to brain and spine, people are a little bit more touchy
Yeah.
rather than getting constructive surgery. They're more touchy about their brain and their spine.
Exactly.
And the other thing is the trust. The trust level has gone down with the surgeons.
Well, we still need to figure that out whether it has gone down or not, because I've seen two people over here, before I was going for my surgery. So they got their surgeries done from here. I'm not going to name the doctor, but then they can hardly walk now after their surgeries.
Terrible.
And then they were the ones who said that, son,
Well-
do not take a risk over here.
Well, if
So
I
then
give
why
you
do
a little
think
bit
that
of the
there's a
facts.
trust deficit?
Well, if I give you the facts, we operate about 1,100 to 1,500 laminectomies in 1 year in PIMS. We have done that. 1% to 3% of the patients would have the same problems as you told me about that guy who could not walk. It depends on when you present to a doctor. Most of the times when we are doing our OPD and we're seeing patients, we tell them to get an MRI done, and right away they get scared. And once they come back with the MRI and we tell them that there's a lot of compression, you're feeling numbness and your pain is not going away with the medication, the result, the final diagnosis and the final treatment plan is surgery.
All right.
And that's when they walk off. They tell us, we will decide, we'll discuss it with our friends or family, and then we will tell you whether we want to get operated.
But half of the time when you're going for the MRI, you feel as if you're being admitted in a mortuary.
Oh gosh, scary.
You might not even make it back. That's why they get scared. But Ma, you want to
Yes.
Yep, sorry, continue.
Yes, that's true, because there's no awareness about it. They're not told about it, as well as the doctors don't even have that much of a time that they could actually counsel the patients and their attendants that you are going to go through a certain process that is going to be a little difficult for you to handle. And then when you come back, not every back pain needs surgery. Well, that's where
Thank
we
you
have
for
gone
saying
right
that.
Good. Okay, now moving on to the reconstructive aspect. So what kind of reconstruction, is most popular within Pakistan?
Within Pakistan,
Not popular, sorry. That's not cosmetic. I mean, with,
it's
done
a
most.
requirement basically. Mostly people with the burnt faces, they're more keen on getting their surgeries done, because with a burnt face you can't move around. People are always looking at you, and there's some, there's a social stigma that is involved with burns, and then you get asked a lot of questions as to how it happened, and you don't always want to go into that because it's always traumatic for the patient. So yes, burns, I would say, is one aspect of reconstruction that is very common in our practice. And then lower extremity trauma over here, because of the traffic situation. We all know how it is. And motorbikes are very common. And these people, the bikers, they usually sustain lower limb traumas. And then
Because half of them drive like, maniacs without helmets, zooming in and out. Sorry, but we're going to have a show on road safety soon.
Okay.
Continue.
you should. I guess yes, we should. You should look into preventing these major accidents. But we should always also educate the doctors as well that lower extremity trauma is not always orthopedics alone. It's always, you can't do it without a plastic surgeon nowadays, and that is international protocols.
Okay.
Okay, but then at the same time, since I was asking about the stigmas attached to neurosurgery, I'm going to come back to not reconstructive surgery, but cosmetic surgery or aesthetics.
Sure.
Now, half of the time what happens is for all those people whom I have known, first of all, they do not even tell anyone that, we've got that surgery done. And then before that, they do not even tell their parents or ask or seek for a permission that, this is what we're going to do. Don't you think that it's a doctor's responsibility to ask whether you're going to have an attendant or probably have you told somebody if he or she is a minor?
Yes, I think it's a good question, but it's difficult as well to answer. Medical legally, anyone who is above the age of 18 and we consider him or her as an adult, and they're authorized to sign the consent form and they can undergo surgeries as they wish.
Okay.
But yes, we do ask attendants for attendance, and we do ask patients to bring in somebody for help, obviously, and God forbid, if anything goes wrong, somebody should be there who can take a decision for them.
Okay.
Because they'd be under anesthesia.
So it was a diplomatic answer.
That's very diplomatic.
Thank you.
But also, in Pakistan, the situation culturally is differently because a lot of adults beyond 18, rely on their parents to survive. So technically, their parents still, can tell you what to do until you're independent. Now, in regards to cosmetic surgery, what is the most popular surgery within Pakistan?
Within Pakistan, I would I'd bet on abdominoplasties and tummy tucks.
Really?
Yes, yes. Those are really popular here.
Okay, I was thinking, once, because I used to weigh like 110 kg back in the day. I thought about it that, I should actually get a tummy tuck. But then I was like, what if it comes back again? Does it happen? Does it come back again as well?
Well, actually, scientifically speaking, the number of fat cells in anybody is constant. Like if you have 1 million fat cells and somebody takes out about 0.5 million of them out, those fat cells will never come back. But yes, if you do not maintain a diet, if you don't exercise, the remaining fat cells, they'd attain a size equivalent to what you had previously. So yes, the fat does come back, and you do if you don't refrain yourself, and if you think that liposuction or abdominoplasties are a shortcut, they are a shortcut, but short term.
I think those abdominal straps are better.
It's not magic, right? You have to have a certain lifestyle. Okay, now I just wanted to come back to the neurosurgery aspect. What are the most common diseases that are in Pakistan at the moment with the brain and spine at the moment?
One of them is the backache.
4 or 5, yeah.
We have a lot of backache patients.
Okay.
And in the north, brain tumors.
Okay.
A lot of brain tumors are there. They're being operated all around, and we're overburdened with them as well.
Okay.
And similarly, backache, the problem is most of the times backaches are dealt by 2 or 3 different people.
Okay.
Different consultants, orthopedic surgeons, spinal surgeons, and now neurosurgeons.
Okay, we'll definitely ask you about the reasons as well, but right now we need to rush for a short break. Don't go anywhere, ladies and gentlemen, because today we're talking about something which a lot of women might be interested in. And guys, all right, men, I said it, okay? Let's go for a short break.
And all the people who had it, are men, so let's go for a short break.
Fusion is a genre.
Some of the world's most fascinating brasswork originates from the city of Peshawar in the province of Khyber Pakhtunkhwa. Brasswork involves engraving beautiful patterns and shapes using traditional methods known as Naqshi to describe sketching and Kudai, translated means scraping. Swat is renowned for its woven textiles and embroidered products. While weaving is carried out in many major cities, Swat in particular is a long-established weaving center whose blankets are mentioned even in early Buddhist texts. Swat has also retained its traditional form of embroidery, which is probably the most creative and colorful needle artwork found anywhere in the world. The enchanting arts and crafts of Pakistan.
They have no wings, but they fly. They have no fangs, but they bite. They have no eyes, but they witness. Rumors, the war on minds. PTV World, shunning rumors.
Welcome back, everyone. And before the break, we're talking about plastic surgery, cosmetic, reconstructive, and also neurosurgery. And we were in the middle of the conversation finding out what are the causes of all these surgeries.
Yeah,
right?
and Dr. Rayif was just mentioning that, up in the north, there are a lot of a lot of other problems with
Brain tumors.
brain tumors, and then over here we've got these lumbar spine and all of these other things as well. But now, what are the causes of brain tumors and these lumbar spines? Because whenever we see somebody very elderly or not even that elderly, they'll always complain of backache. So is it lifestyle or is it something other than that?
Well, it's a combination of both. First of all, the diet that we use, that's not that good. We're not good at nutrients. We don't take the fresh nutrients as well. As our social stigma, we don't actually have green food. So the lot of vitamins and minerals that are required for the bones and the muscles and the ligaments, we don't actually take them in the raw form. We actually burn everything.
Yeah.
That's one of the reasons that we have overcook
which we
it.
call well done.
Well done, or even charred.
Okay.
Yeah.
But the brain tumors, I just want to clear one thing.
Yes, please
Brain
do.
tumors are always genetic.
Okay.
Either it can be genetic it can be familial from family to family, or it can be a mutation. And for that you need to have a certain exposure to radiation.
Alright.
In the north it is present because of a lot of things. The radiation from the sun, they're more close to it, they're more UV rays, and but the most important thing is genetics. If you have a genetic factor for a particular tumor, you're going to have it.
Okay, so in regard, if it's all genetic, then obviously there should be some sort of screening or some sort of lifestyle like these families should adopt medically.
Yes,
So what
that
should
is
they do?
why we say that if family members or cousins are getting married, they should get that tests done.
Which
They should
test is it?
It's basically the HLA matchings, where you check whether there would be any genetic deformity in your children or not. So you would have to get that done before.
think that
And
is very
that is,
essential.
and that's essential, and it's there, so people should utilize this.
Yeah, absolutely.
resource.
No, but then at the same time, since we are saying that, it is very common up north, so then let's talk about the symptoms of it, so that, if somebody is not unaware of the symptoms, I think it'll be very hard for them to figure it out that, they might be going something such traumatic.
Well, I was thinking about it that I need to tell about a couple of things that everybody should remember.
Go ahead.
If you have any sort of pain for more than 24 hours, get yourself evaluated. Whether it is headache, whether it is neck ache, it is backache.
Migraines?
Get it checked. Well, migraine is a different story.
Okay.
That is not a disease actually.
But
it
we'll
is a
come and talk
condition.
about that in a second.
Well, for brain tumors or backaches or any other spinal tumors, if you have any condition, if you have got numbness, that's an alarming situation. If you can't feel anything, or if you're feeling weakness in a part of your body, that is also a problem. You have to get yourself evaluated. The problem is we go to the doctors, and I don't blame them because they're not specialists. So they give you painkillers. But what I want to emphasize here is that it's also the patient's responsibility as well. It's his body. So when you're feeling something, go do a little bit of research, get a little bit more educated, and go to the specific doctors as well.
Yeah.
Okay, now in regards to doing research, where do people, like, obviously Google is great, but you know, how are you going to find out if this doctor has got the right qualifications, the right experience, is not going to just, you know, these tests and all these things just to waste money and, you know, raise their bills?
First of all, if you're going to a reputed institution, I think that is enough
But
for
even
you
they're
to get-
guilty of malpractice at times.
Yeah, well, that can always happen.
Okay.
In a society in which everybody does it, you cannot actually keep the doctors away from it.
Yeah.
So I keep on saying this, that doctors are from the same society. If 1 or even 10% or even 30% of the doctors are doing it, they're going to be always there. You cannot exclude them, as this is going to be in the business community, in any other community of the society. But what you need to understand is that once you go to a doctor, at least give him that much of a trust.
All right.
What people do, I'm saying it's a two-way story. When people come to us, they actually don't give us the whole story. They actually don't want us to know that they already been to a couple of consultants,
Yeah.
and they've been referred for a specific thing.
They call it second or a third opinion.
Yeah,
Dr.
second or third opinion. But at the same time, they're actually judging us as well.
Yeah.
Whether we would be saying the right words or not.
But it's their right.
No, but it's their right. They're giving you their body to fix, and obviously it's up to them.
Yes, I don't mind that.
Yeah.
But you know what? At a particular position, if you've been having migraine for about a week,
Yeah.
and you've been to 3 or 4 different consultants, and now you're being referred to a neurosurgeon, I would like to know that how long have you had that migraine?
Of course,
Yeah.
yes.
And what were the symptoms? You cherry pick that, and you tell me that I just had migraine since yesterday. Now that's a problem for me, because if it is just migraine, it's not a big deal, because it's going to go away in 48 hours.
Yeah, that's why they say never lie to your doctor and your lawyer as
Okay,
well.
but then another aspect that comes into that is the trust issue that you were talking about before, because like you said, you can't keep malpractice away from things like this. However, you need to protect yourself, and in such a society, things do come back. So what are they supposed to do? Because you're stuck between a rock and a hard place. I'll ask you this actually, Dr. Uzair. What should a patient do?
I think what Dr. Rayif has pointed out, I agree with that. People do go doctor shopping, and they do, they do try to manipulate you in certain ways. They don't tell you the complete symptoms. Sometimes they go like, oh, I told this to the other doctor and he gave me this medicine. I already have this medicine, so I'm going to tell this one something different.
Okay.
So, I guess truth is the way to
And then
go
there's
about it.
competition in between doctors as well. So, whenever you walk into the clinic and if you're a doctor shopper and if he asks you by chance or by luck, you take that name, he or doctor might go like, oh, he or she does not know anything,
Yeah,
You've come to the right spot.
Yeah.
But then how you just mentioned that, it is very necessary to go and get yourself checked. So I was feeling a bit of heartache. So I went to the doctor, got it checked, and he told me that it was broken. What do I do now?
I think that is
Did you just...
I think that is more of a
Oh, well, it depends now. Man.
Okay,
I cannot tell
anyway,
you
guys.
about that, but that was just a silly joke.
Yes.
But on another level, I just wanted to come back to migraine. All right. So, is there any connection of migraine with your stomach as well, or what you eat or what you don't? Because
No, he said no.
nothing.
No.
And that's a question which is on our Facebook page right now.
All right, I'll tell you one thing. First of all,
Because
we
the guy,
need to...
the guy actually says that whenever I eat food, that's when the migraine starts.
It's an interesting question.
It also would depend whether he is doing anything else other than eating.
What can be that?
Well, that can be he might be overstressed. He might be eating at a time when he is really upset.
Yeah.
So that can
Or
cause
he
it.
might be overeating as well.
One of the things that I need to tell you is that you first need to identify that whether it is migraine or not.
Okay.
People usually have high blood pressures.
Okay.
They have got chronic sinusitis. They got middle ear infections, and then they present with headaches. Usually, if you have an ear infection in the right side, you'll only get a headache in the right side because there's an infection. So you need to exclude all these things, and once you're done with it, then you can label somebody that he or she has migraine.
Okay.
So if somebody comes to you with the headache, and typically migraine is only in half head. Atypical migraine can take place on the both sides. Otherwise, migraine would be on one side of the head only.
All right.
Okay, so basically it's not linked with food then?
No,
it's
it's
just
not
kind
linked
of
with
about stress or
Whether
high
it's
blood.
fast food or whatever.
Yeah, whatever.
Okay, so basically high blood pressure, infection, stuff like. Great, that's really informative. Thank you. Now moving back to the plastic surgery side, the resources within Pakistan, like you said, there's not more than 100 plastic surgeons. So what are we doing about this?
The faculty has recently, they've recognized a lot of good centers around Pakistan, and now that the need has been realized, both in the public and the private sector, so they're working together, and there are a few very well-reputed centers now coming up in Pakistan. They're training a lot of plastic surgeons. So I guess in a few years' time, I'd say we're looking at 5 years, the number is going to multiply by 10 even.
Okay, that's great. But now there's one more thing, which I want to ask for the convenience of the general public as well, and that is that, half of the time when you go to Sunday market, there's a long list of all those vegetables and fruits and their retail prices. Why is it that, every other doctor you visit have got a different charge for their different operating procedures? Do you think that there will be a time, or then there will be consensus in between doctors that this is what we're going to charge for a heart surgery or a plastic surgery or this tummy tuck or this? Do you think there will be a time of this sort?
I doubt it, because things need to be standardized before we can start talking about prices.
That's what we call consensus, that you standardize things first.
Yeah, but cosmetic surgery, it's basically it's a surgery that it's a luxury.
No, it's not just about cosmetic surgery. Now the thing is that half of the time people are losing their lives just because of the fact that they cannot afford so much of it. Right? So then, don't you think that something needs to be done in this area as well?
Yes, there are a lot of hospitals that offer special packages and concessions for patients who can't actually afford a surgery that they really need.
But not for cosmetic or reconstruction.
No,
for cosmetics, not your insurance companies don't even cover cosmetic surgery. So, as far as reconstruction is concerned, I can prices are really, they're negotiable all the time. You can always ask your doctor for a concession and he might oblige.
Okay, and to be honest, that's the practice all over the world. In America, in England, you don't have one set price. How good you are is how much you can charge. It's on your experience. Okay, now, with regards to the practices here.
Yeah, go ahead, just like that.
Okay, now I want to come back to the...
This is the only difference in between public and private, right?
Yeah, but I want to ask about the acute burns and the rehabilitation situation within Pakistan, because that is an issue here. What are the services available for that? What are the, when you go as a therapy, after they've had the surgery, do you prep them before? What is what is the process?
The first and foremost thing to do is that you try and shift the patient under care of a plastic surgeon or in a burn center as soon as possible. Burn centers are really scarce in Pakistan because of the resources involved.
Okay.
But there are quite a few in the Twin Cities. The PIMS has a burn center. There's one in Nescom, and then there's one in Kharia, one in Wa. So, but obviously the situation goes bad in winters, and all the beds are occupied. You just have to make sure that the person who is treating you, your primary surgeon, is a plastic surgeon or has vast experience in burns.
Okay, and in regards to other, the plastic surgeon, like you said, nowadays you can't ignore the plastic surgeon. How are the medical community with you guys? Are you being involved more in these things, or are you still being sidelined?
We'll probably do it ourselves.
Yeah.
No, the new textbooks and the new training that everybody is receiving, it's more of multimodal for everybody, and a team approach is always necessary. So yes, we've been accepted, like he is accepted in Pakistan, so yes, we are.
All right, so I'll just move on to you now. Now, what happens is that, a lot of time when you get these surgeries done, you need a lot of rehabilitation. And before that rehabilitation, you only reach to the point where you need a surgery because the physiotherapist wasn't really that good. That's what happened to me. So the physiotherapist used to come over every day and he'll massage and he'll put those equipment and give me some current shocks, which way my disc was going. He never knew that. He didn't even have that idea. He wasn't that trained. So how is it with, in respect to the neurosurgery, how is the rehabilitation?
Well, we don't have that many rehabilitation centers. One of them is in CMH that has been there for the last 3 or 4 years, and they got very good people.
I
But
think
other
we've got
than
one
that,
in Fauji Foundation as well. I think so.
that just started, I think, last year.
Okay.
But you're right, we don't have that many people and learned people in physiotherapy as well. What we generally do,
Because all of those, sorry, I'm cutting you, because all of those people who've actually suffered through brain hemorrhages, their limbs still cannot work. I mean, if we were there, and if we would have progressed, I think they would have been fine. No?
yes, agreed. But these things keep on evolving. Like neurosurgery, before this, usually specifically and specialized neurosurgeons were not present.
All right.
It's been just about 10 years back, and you were talking about the plastic surgeons being 100. I think they're not more than 130 or 140 neurosurgeons in country as well.
Really?
And most of them have flown away as well. So the ones that are here, they're working in certain conditions that you cannot actually practice all of the neurosurgery.
All right.
And there are certain gray areas as well. While we're talking about the spine, they've also been done by spinal surgeons, by orthopedic surgeons, and neurosurgeons.
Yeah, that's what I wanted to ask
Yeah,
as well.
yeah.
Because the other day, one of my friends called me up and he goes like, oh, which doctor did you go to? I told him that, I went to a neurophysician first, then to a neurosurgeon. It was like, well, my father's saying that, you need to go to an orthopedic. I was like, well, let me ask somebody. So I had to call somebody else. So now, how do you think that we need to decide whether to go to an orthopedic?
Things are evolving. First, it was the neurosurgery, and they used to do everything, the brain and the spine. As long as it involved the bones or the vertebrae, orthopedics people also used to do spine as well. But now things have become more specialized. They are spinal surgeons. They're not neurosurgeons or orthopedic surgeons. They're specialized in spinal surgery only.
Okay.
So if you get a spinal surgeon, that's fine. If you get an orthopedic surgeon, if he's got, like Uzair said, if he's got a vast experience in spinal surgery, that's fine also. If you get a neurosurgeon who's got a vast experience in spine, that's fine as well. But to be safe, you can go to a spinal surgeon. Those are very few right now. One of the hospitals, Gurki in Lahore, they're training spinal surgeons, and the other one is Doctors Hospital.
But if after the surgery we do not have any rehabilitation centers or none of the rehabilitation processes, why do you think that anybody would actually go to the doctor and say that, okay, go ahead, operate?
Well, every spinal surgery does not need rehabilitation.
Okay.
There are certain situations at which you present. If you got muscular loss or you got weakness in your limbs, then you would need rehabilitation. Other than that, you don't need rehabilitation. And that is the far most important job of a doctor, of a surgeon, to counsel you before the surgery that what is that you require after the surgery. Okay. We usually make the patients walk on the 3rd day and send them back home. Yeah. And we tell them...
That's what usually doctors say though.
Well, it depends on the situation, right?
It depends on the situation. I'm not going to defend everybody.
Yeah.
It's not a 100% situation. But most of the times, more than 80% of the times, it happens like once you operate, you send the patient home, they're happy. If they're not happy, we're still there. We're not running off.
Okay.
So they can always come back. And
now it's them who cannot run. That's what I would say.
Well,
that's a really...
Well, you can always come back and ask them.
Yeah.
Because if you're sitting in an institution, where that's what I said.
I think it's very
in the
bold
beginning.
of you to say that as well, that we are still there and you can come back.
Absolutely.
Not many doctors do that as well.
Okay.
And I've seen doctors fleeing away as well. So it's
Oh,
all
there
right.
he is. I know. Okay, now just moving on to the plastic surgery. I was meant to ask you this before, but in regards to when people come to you with the scarring situation, because like we said about magician work, what is the situation? Like, what's the awareness? Do people expect miracles or?
Well, I'm really glad you asked that question, because even the most intelligent patients, they ask you, Doc Saab, scar to nahi padega? Well, yes, there is always a scar, because we don't have godly powers. But yes, we are magicians in a way, because what is magic? You create an illusion, and that's what we do. We try to hide the scar in certain places, in natural creases of the body, and we try to be meticulous in our surgical techniques. We try to put fine sutures in, and rest is reassurance and post-treatment care, massages and silicone sheets and all those things. So the scar is there, but we try to make it less conspicuous, that from a respectable distance, the other person doesn't keep looking at your scar.
So if someone comes up, they'll be looking at your scar like,
Or
what?
probably you can wear base as well. That's pretty much
That's
all right. Scars not
that's
that
an
much
accepted concept. It's called camouflage. So
yeah.
you
I
can-
mean,
But
that's
then-
what we're doing right now,
Yeah,
right?
but then at the same time, is it safe?
What?
Cosmetic surgery.
Oh, right.
Cosmetic surgery is supposed to be safe, because if it wasn't safe, then it wouldn't have been done anywhere in the world. What you can do is you can try to ensure your safety by selecting a certified plastic surgeon. A certified plastic surgeon would be one who is registered with the College of Physicians and Surgeons, who's done his FCPS in plastic surgery in Pakistan, and who the PMDC has recognized. And if he's sitting in a reputable institute doing plastic surgery, then you have a safe bet.
Okay.
Secondly, the surgeon makes sure that you see the anesthetist, and the anesthetist rules out if there is any problem that might complicate the situation further on.
Okay, now I just now want to get to the psychological aspect of it all, because at the end of the day, you guys are not therapists or whatever. However, you must, when you have patients coming in, you must be able to see that they don't need it, like this cosmetic surgery, but there's some sort of addiction or there's some sort of psychological issue going on. Now, when those kind of patients come to you, what do you do? Sorry, that's quite a...
No, that's an interesting question, because yes, every patient who's coming for cosmetic surgery has their own concerns, and even though sometimes we might think that they look normal, but or they look how they're supposed to look, but they're not happy with it, and at the end of the day, it's them who have to look at their faces every day in the mirror.
Yeah.
We have red flags, yes, and red flags as if a male enters our office, that's a red flag right there. A male coming for a cosmetic surgery,
Why?
that's a red flag.
Why?
It's research.
Okay.
It's just because
Please quote some. I'd like to...
the only 3 plastic surgeons that were murdered by their patients were male.
Okay.
So they.
I'm going to get some research on this, because I didn't actually look at the gender situation. With
The gender
but
situation
why
is
is that a
there.
red flag though? Because
Males are usually, males
care.
usually don't concern themselves with these issues, but females tend to do that a lot. So a female coming into our office is pretty normal for us for cosmetic surgery. But a male, yes, our ears go like this, then we need to listen to
Yeah,
them.
really? You want to get it
And
done? All
and
right.
we can say no to them, even if they really twist our arm really hard to do cosmetic surgery. But at the end of the day, we have to realize it's not something you'd like to put their life in danger, or your life for that matter.
yeah, clearly,
So-
because you can get
Okay.
killed.
So let me just ask you, is neurosurgery safe?
Well, not always.
No, always. L2, 3.
And that is the thing that the surgeon needs to tell the patient as well.
Yeah.
If you're doing spinal surgery, well, there is reported cases that 1 to 10% cases will not be 100% okay.
Okay. So what about brain hemorrhages? Do we have any surgery or anything for that reason as well?
Yeah,
Because a lot
we
of time people do not even get that surgery done. They just want to stay
Yeah,
the
well,
way they
that
are.
is- the problem is awareness. People actually don't know that anybody can do anything about it.
Okay.
And the first thing is, people actually don't follow their doctors, their
Yeah.
medication. Brain hemorrhages usually happen when people are not taking their cardiac medication. And once they're getting high blood pressure, they're getting headaches, they try to ignore it.
Yeah.
ठीक हो जाएगा, कोई मसला नहीं,
They'll be
चाय पी
fine.
लेंगे, I've been under stress and that's why I'm getting headaches. But what they actually don't see is that their blood pressure is high, they're having constant high blood pressure, and they're not taking appropriate medication for that.
Okay.
And that can only lead to one thing.
Okay, very nice. Now there's one more thing, and which I think that everybody has a right to know, and that is that half of the time whenever you walk into a clinic, now the first thing is that doctors are businessmen these days as well. I'm not saying that you guys are, but they are. So now half of the time whenever you take your reports, MRIs or whatever, they might not even take a look at it. Oh, you need a surgery, just like that. And then that's why you actually have to go doctor shopping.
Yeah, I was told recently I might need one. I was like, what? No. And then
So then, it
It's
gets very
ridiculous.
difficult for us to decide whether, he's the one who's telling the right thing, whether he's the one who's telling the right thing, who's telling the right thing then? How do we decide?
Yeah, well, that's why I said it in the beginning that if a consultant is sitting at a reputable hospital, you can always get them checked.
Okay.
And there will be always there. If you get an opinion from someone, it's their opinion. There are always two types of people, those who are aggressive and those who would see whether we can give the patient a little bit of more time. So both of the concepts are right. But it depends what sort of a doctor you're going to.
And
I'm not going to defend everyone, but I'm going to tell you one thing, that once a doctor tells you that it is surgery, yes, you have the right to have a second opinion. But if the second doctor also tells you that you need surgery, then it is done.
Okay.
You don't need to go to 5 or 6 people just for your own opinion.
Okay, and I just, while you were talking, I just did some research as well, and in regards to male and female psychology who go for plastic surgery, men who go do have more psychological disturbances and they're more prone for body dysmorphia.
Yeah.
Women who go are more psychologically stable, they've assessed it more. So you were right in that. So
Earlier it was
it
lawn
wasn't
fever.
gender
Always
discrimination.
am, always am.
Well, earlier it was lawn fever, now it's the cosmetic surgery fever as well within the country. But then how many surgeries can you actually go for in one particular area on your body?
Which is what Michael Jackson did to
Yeah,
himself.
I mean, pretty much as many as you want, as long as the plastic surgeon knows what you're doing,
Yeah.
what you want, and what the plastic surgeon is doing.
Okay. No, because in America we saw this real life Ken man doll.
Barbie doll.
And they've like the
guys
Ken
doll.
and Barbie. So
See, that looks really plastic. So you
awful.
need to tell your patients about that. You need to educate them. With cosmetic surgeries, I usually prefer to have 2 or 3 pre-surgery sessions before we actually do something, and that really, that gets out of the patient what they want.
okay.
Okay, then,
Okay.
but then why were you saying that, half of the time when it's men over there, in your clinic, there's a red flag. And
Because
you
they have
probably tell
No,
them
we-
that, you don't even need
We assess a lot of things, like if a politician is coming to us, or a businessman, or somebody who wants to be on TV, who has to be on television all the time, and they're looking for a facelift. That's pretty normal. They really, they might benefit out of it. But sometimes people just come to you and they
Yeah.
ask for their. You'd be amazed
For
if you
men,
come to my office sometime.
No, the psychology behind male patients is that they have a history of depression or maybe even a personality disorder. They have
Whenever
issues.
somebody relates their looks to a situation in life or a bad situation, for example, if somebody thinks that if my ears were a little down or my hairline was a little up, then my wife wouldn't have left me. Then that's really something trivial, and they should really think about
And
it.
people do say that.
People do.
They
People
do.
Just
But-
because of the hairline.
Yeah, people.
Because of several things.
Well, I think it
People
was-
make excuses.
It can
They
be
don't like to
because
know
of
that-
the hairline, but it can be because of the money line in your palm and right over here. So
What kind of people do you hang
get
out
it
with?
drawn, get it drawn over here.
Anyway, we've run out of time. Thank you so much for joining us today. It was a very interesting conversation.
It was a pleasure.
Thank
It
you
was
very
our
much.
pleasure.
Thank you very much.
Okay, guys, so that was a lot of information for you. I hope you took something away from it. But at the end of the day, what we learned from today was that we have to do our research and, tell the truth to your doctors. If they do break that trust, then use the systems in place to go after them and get them into trouble.
And
because
we
that's what you
actually,
do.
and we actually try to convey that, if you are to check whether the doctor is a good doctor or not, so we shared all of those standards. You can actually watch them in the rerun as well.
Yeah.
We'll put it on our Facebook
And
page.
last thing
Sure.
is that, there are a lot of good doctors out there. You just have to kind of, look for them and, don't be silly about your health.
And not every doctor is a businessman as well. So don't
Exactly.
forget to log on to our Facebook fan page, which is with the name of,
Well, this morning.
on Twitter,
Well, this morning without a G.
on YouTube,
Well, this morning.
on Daily Motion.
Well, this morning.
And you can catch this fabulous repeat
at
at
5 past midnight. Have a wonderful day, and we will see you bright and early tomorrow.
1, 2, 3.
Good morning.